So, what happens? What would be the potential health consequences if this OSA is untreated?
So, primarily, obstructive sleep apnea manifests in two broad ways, right? One broad way is because of sleep fragmentation. Now, what is happening? Because the person is unable to sleep or is not, see, it's all about the quality of sleep. It's not quantity of sleep, right? You may be lying in bed for 10 hours, but not sleeping for various reasons. So, this impaired quality of sleep results in what we call as sleep fragmentation. As you know, sleep is not a single stage but has multiple stages. So, for example, in the initial few hours of sleep, you are getting what we call as deep sleep. This is very, very restorative for the physical well-being, all right? Whereas in the later part of the sleep, one gets what is called as REM sleep or rapid eye movement sleep, which is very important both for mental and physical well-being. So the moment that doesn't happen, or it doesn't happen in the quantities that it should happen, it results in what we call as neurobehavioral problems, right? If these neurobehavioral problems are on one side, the inability to breathe or the increased work of breathing actually results in what we call as cardiorespiratory problems. So, the basic consequences of not breathing properly and not having good quality of sleep will result in either having neurobehavioral problems or having cardiorespiratory problems or having both of them together. And hence, for example, because of these neurobehavioral problems, what happens is a person becomes very agitated. The person would get very irritable. So even if you're asking the person a very simple question, he's biting back at you, for example. Then as a person who's asking the question, say, why is he responding the way he's responding? So you would actually see a change in the behavior of these individuals. Somebody who was calm and cool would become very anxious, very agitated. They would have memory issues because they keep forgetting things. And these, because of this impaired quality of sleep, they are more vulnerable to very dreaded conditions like strokes, right? Which can land up in very bad CNS problems. On the other hand, the cardiorespiratory problems are more in lines of myocardial infarctions, also known as heart attacks, rhythm disorders, that means arrhythmias, so on and so forth, things like increased pulmonary artery pressure. But primarily, the consequences are the biggest problem. It's not the condition itself.